Well, I like to quote Hippocrates, who said, I don't know, 2,000 years ago or 2,500 years ago, that the role of the doctor is sometimes to treat, often to relieve pain, and always to comfort. And I think that we're still here to help manage patients. And I've been taking care of people with Alzheimer's for 40 years now. And we don't have any miracle drugs, but families and patients and caregivers, they need the help of a doctor. And you mentioned the referral to a geriatrician. I'm a geriatrician. There's very few of us in the United States. There's just not enough of us to go around to manage patients. And I do get referrals from neurologists, or I get patients who have been to the neurologist and then they want to come to the geriatrician for care. I think it's changing over the last few decades as I've seen it. But I think one thing that's really important for the neurology community, and I hope this is changing now, is that we need to care for these patients. I don't have to talk about the problems with this disease that it creates for the patients and family members, not just like alternate medical management for things like agitation and verbal violence and all this other physical violence, but also just quality of life and things like that, and appropriate use of currently available drugs. And I think there is valid examples of off-label use, and and there are patients out there who are desperate for possible treatments, and I think there are two options for those patients. The neurologists can know where to refer patients for clinical trials, and right now there's about 250 clinical trials going on with about 126 drugs. I think the data is something like that. So for those patients who want to try to benefit from a clinical trial, that's one piece of knowledge beyond care and management that I think we can do as physicians to help those families. And for those that want to try off-label use, I think there is, I'm not promoting that, but I think there are some examples where drugs that are available for other neurodegenerative diseases that neurologists are used to using and used to prescribing for diseases like ALS and Parkinson's, that they can be tried in people with Alzheimer's disease. I'm not promoting it. We're doing clinical trials to see if they work. But I think the main thing is really just to care for people.